Welcome to our webinar. So today we are hosting the webinar, but we are very lucky to be joined by Public Health England, who will actually be presenting the content of the webinar today on inequality resources in support of the maternal mental health services bids. So this is an extra webinar we've put on. Many of you will have probably already joined us for the webinar that we had on the 15th of July and the 12th of August in preparation for these bids. We were very lucky to be joined on the 12th of August by Kate King-Hicks, who gave sort of an introduction in terms of inequality resources. And then the feedback that we got from that webinar was that you would like some more information about that, and so hence we've added this extra webinar in today, and really pleased to be joined by both Susan and Sarah, who are going to be presenting today. So obviously I'm kicking off with the welcome and introduction, then I will hand over to Susan and Sarah, who will be taking the bulk of the webinar, both presenting and also talking you through fingertips and shape, I believe. And there'll be opportunity, so no, just fingertips, is that right? Yeah, okay. And then there'll be opportunity for questions and answers as well at the end of the session. So the webinar is being recorded as usual so that people can watch it who are unable to attend today. And we will also send out the slides following the webinar. Okay. Can I ask you, as usual, in terms of housekeeping, can we just go back up one slide, please, Sarah? Just to remind everybody, if you want to ask a question, if you have the function, please raise your hand, so it makes it easier for Susan and Sarah to spot that, and ourselves. Please also feel free to put comments and reflections in the chat function, and maybe as a way of introduction so that Susan and Sarah know who's on the call, please feel free to introduce yourself via the chat function in terms of your name, organisation, so they know the spread of people that we've got on the webinar. That would be quite helpful. Okay, so without further ado, I'm going to hand over to Susan and Sarah. They are going to be sharing their screens. There's probably going to be just a couple of minutes whilst we just change over. But during that time, maybe you'd like to take the opportunity to put in the chat function who you are, where you're joining from, and then Susan will take over. Thank you very much.
Okay, can everyone see the first slide? Data and tools to support the design of perinatal mental health services, because I'm sharing my screen.
Yes,
yes.
Susan. Yeah.
Okay, great. So good morning, everyone. My name is Susan Coppler-Slater, hopeless spelling, but easy to say. And I'm from Elkis South East with Public Health England, and my focus area is children, young people and maternity. And I'll be supported by Sarah Priest, who is your knowledge transfer facilitator, again for Elkis South East.
So, hi, everybody.
Yeah, hello. Yeah. Brilliant, thanks, Sarah. Yes, so she is there. The plan for the webinar is, as Liz has already said, it's a follow-on from the presentation that Kate King-Hicks gave some time ago. So some slides you will have seen before if you were in that webinar as well, because I've used some of Kate's slides, but they will act as reminders, I hope. I'm kind of planning to have questions at the end, or we might have them in the middle, because I've got an inequalities bit at the very end that we may or may not get to, but the slides will all be there for you to help yourself. But if you could note down your questions in the chat box, that would be great. And like Liz said as well, if you could introduce yourself in the chat box so that I mean, I can't see the chat box, but you can see who's there, you know, so that you can liaise afterwards if you've got any work you could maybe do together. The webinar has been planned as a slideshow, but if there is time around sort of the middle towards or possibly the end, we could do a click along if you all feel the need, and if you've got, you know, if you've got your internet and everything ready to go, we could have a go at that if that's all right. And please do remember there will be further support necessary after the webinar, available after the webinar, and you just need to contact LCAS Southeast, and I've given you the email address there on the slides. Now I just need to know, so just very briefly, you can unmute your button or use the chat box, but I can't see the chat box, so I would need Sarah to tell me. I just want to ask, so that I can tailor the presentation, is there anyone who has never heard of fingertips?
Hello,
Anybody?
it's Karen. I've never heard of it. I'm from Oxford Perinatal team.
Right, okay, that's very interesting, because obviously we'll go through the basics for you. Is there anyone who is aware of fingertips but unsure? So have we got more than one that needs to do the basics?
I think there was a couple of hands up or yeses.
Right,
For
okay,
Yeah,
great, because I
yeah.
can't
Yes,
see that.
That's
yeah.
okay.
Yeah,
A couple
because
of
I'm
yeses.
Great. Okay, so what we'll do is I'll try to go relatively slowly and thoroughly. We'll go through the basics. But like I said, if we do run out of time, should that happen, there will be further. Sorry, I've got a reminder come up. I'll try and get rid of that for you. There will be further support afterwards, so don't worry. You know, we'll just go at your pace and make sure that you're happy with this tool. It's actually quite relatively easy to use once you understand, you know, the basics. And it applies to all profiles on the tool, so it's not just the perinatal mental health profile. And like I said, yes, there's further support available from Sarah. Peter Cornish and Joe Wall are also in our team, but they're easily contacted by the LCAS Southeast email. So this is the slide from Kate King-Hicks, which I'll skate over. Basically, she's talking about, you know, those expressions of interest that you're all going to be using and demonstrating, which will need an understanding of the needs of your local population, the women in there and their segmentation. So, you know, which ethnicity are they? What age are they? What are their needs in terms of the mental health support services that they will need before, during and after their pregnancy, because obviously perinatal mental health lasts well after the birth of the child. And let me just remember and remind us all of the importance of perinatal mental health. In the current you know, years, more recently, one of the highest incidence of maternal death is actually maternal suicide. Obviously, in prior decades, it was poor maternal circumstances, and, you know, the actual birth and the delivery was a risky operation. These days, obviously, we've improved that so very much that those incidences are extremely rare, and unfortunately the mental health aspect and suicide has come to the fore, and that is now one of the main causes of a maternal death these days. That's obviously before COVID, and if you do need to know, or obviously you all need to know, the COVID related maternal deaths, there's details in the recent Embrace report, which was published in May, and makes for some relatively distressing reading, I have to say. I have read it, but I would recommend that you do read it. It's very, very interesting. So without further ado, let's go on to the actual fingertips tool. So the access, so you can type in, as I do, because I always forget the link, is I just put in PHE fingertips into Google, and Bob's your uncle, it comes up and I can click on the tool that I want. And in this case, we are going to look at the profile, which is called mental health, dementia and neurology. Okay, can you all see that? Is that all right? Okay, or alternatively, this is one of Kate's slides. You can type in the link that's at the top of the slide, and again you're taken to the home page of all the public health profiles on the fingertips tool, and then you can see mental health, dementia, neurology is under the national public health profiles with that nice little red circle around it, or it's also actually in the highlighted profiles. You'll see it duplicated there. And if you do forget completely how to use the tool and you can't get hold of us because for some reason we've all on holiday or we had gone down with COVID or God knows what, there is the introduction to using the fingertips tool video at the top right there under the user guide. So do remember that that is a very useful resource also. Okay, so once we're in the mental health, dementia and neurology profile area, there's a number of profiles by theme. And you can see there, the second one down is the perinatal mental health profile. Okay, so we click on that and we come to what's now called the introductory page of the perinatal mental health profile. So this is the introduction page. It's got lots of information on it. We could just go straight to that very friendly looking green start button, but let's just consider what is on this page. So if we look at the bottom left, there are signposts to further resources. Please do use these as well. These are very useful. So you have the Joint Strategic Needs Assessment Toolkit specifically for perinatal mental health. And you should be accessing that and using it. I will mention it briefly in a moment. Then there is the report to mental health in pregnancy, the postnatal period and infancy. And there's the perinatal mental health data catalogue. In addition, as you can see on the right, we will always let you know the latest updates. So do just have a glance and see. And in this case, we can see the most recent updates to this profile were in January 2020. So it's not been recent. We've been very busy with COVID and other things, but it will tell you what's happened in January 2020, what has changed there. So have a quick look at that before you hit that green start button. Everyone hopefully still with me? Okay. So there's the start button. I always think of it a bit like the Hitchhiker's Guide to the Galaxy, and I suppose that shows my age, but it's a very friendly way, a welcoming way to start, go into the data. So press the start button and you go into the data. I'm just going back for a second to see what is in those how-to guides and reports. This is again one of Kate's slides, so you may have seen it before. So again, you can see there's the Joint Strategic Needs Assessment Toolkit. There's the report mental health in pregnancy, postnatal period, babies and toddlers, the data catalogue. And again, can you see below that in the how-to guides, we're looking now bottom left over here, if you can see my little arrow moving. There's a how-to guide. So there's the fingertips user guide specifically for perinatal mental health. And there's the mental health in pregnancy, postnatal period, babies and toddlers, how to use the report. So not only do we give you a report, but we give you a guide on how to interpret, understand the information in the report. Okay, so there are lots and lots of resources there for you. When you're looking at a JSNA, it's important to just bear in mind the components, and this is again one of Kate King-Hicks' slides about the components for a JSNA. So you would need to be thinking about the data profile, which would include elements such as prevalence, incidence, protective factors, risk factors, services, quality outcomes, finance, and so forth. In addition to that, you would need to add some knowledge background. So you need to understand the place that you're providing the service for or planning the service for. You need to understand the people, the perinatal services already in existence, or any other support services that you could draw on so that you would be working in collaboration. You need to understand the profile of the local population of children and young people, the working age adults, and the older years. So you need to build all of that whole systems picture before you could, and that bring it all together. And the approach has usually two aspects for a JSNA in terms of a JSNA process. Is that you would go look initially, I would say, at the national inputs. So you would look at the overview metrics for England, the detailed metrics for your local area, the policy guidance on this service area, the evidence base for what interventions have been shown to be effective and cost effective as well, and the national expert opinion on this service area, this particular a category that you might be looking at. And then also you need to be collaborating locally, which is bespoke to your area, which could be your STP, or it could be a local ward, it could be your local town, where it's the services that you're providing to the population you're thinking of. So you need to liaise with the stakeholders and listen to their voices, listen to the local expertise, the knowledge of the local services that are already available, the local data, which is the bit we'll be looking at, local interventions, and then identify the priorities in that local area before you design those local services. So that's just a quick kind of recap of the JSNA. So bear that in mind, that's what we need. And we now have pressed that start button and we move on to the fingertips tool itself. And this is where it opens up. This is just the top half. But what I noticed with Kate's slideshow is she went beautiful detail straight away, but actually there's a lot going on in this top half. And if you're not familiar with fingertips, you really need a little bit of help, a little bit of guidance as to what all these words at the top actually are and what do they do, because there's loads of functionality there. Okay, so let's take it step by step from the very top. At the very top you have home, mental health, introduction and data. So that's where you've come from. Home would take you back to your fingertips tool homepage where all the other profiles are. We've gone from all the profiles into the mental health profile. We've seen the introduction page and we've come to the data page. So that's what that's all about. Then on the far right, let's not forget you've got technical guidance. Mostly, I must admit, for analysts. But if your analysts do need help, there are AFO reports which tells you about how various things have been calculated and various standards we use. So there is some very detailed technical guidance there. Very important also is the contact us. So the contact us is your feedback button. If there's something that you think should be there and isn't, or there's something not working, or there's something there and you don't agree with it, or it seems to be out of date, let those people know. It'll be the fingertips team that will contact you in response. But we adore feedback. We live for feedback. So please do use that button so that we know how we can improve our services and our tools to better support you. And then next to that is a little button says your data, which we're going to come back to a little bit later, because you can actually have custom data and custom geographies, which you may be interested in. Okay, hopefully everyone's still with me. The next bit, we've got this grey area, a long toolbar, and in this particular profile, although it does change for other profiles, which I will cover, for this particular profile, the domains of the perinatal mental health profile are in this grey toolbar. So you have 4 domains in which the indicators are categorized or grouped. So you've got demographics, risk and related factors, excuse the dogs, hopefully they're not too disturbing, prevalence and identification and access. And we'll be looking at each of those. So you just click along and those are the different domains. Below that is a very important toolbar indeed. This is your visualization toolbar. So this is where you see the data in pretty pictures and charts in different ways. Okay, so the overview is like a tartan rug. Compare indicators will show you a scatter plot. A map will give you a map, but also a very useful bar chart. Trends will give you, funnily enough, a trend chart over time. Compare areas will give you a bar chart. An area profile will give you a profile in the form of a spine chart for your area that you have selected. Reports will give you the reports that have been written for this topic area. Definitions is the definition or the metadata, as we know as analysts, which give you all the detail about any given indicator. So that's incredibly important. We will be looking at that, because if you don't understand the definition behind an indicator, you can't really use it properly. So please make it a rule, make a note for yourselves now. You have to always look at the definition for any indicator that you want to discuss or use in a report, so that you properly understand the basis, the rationale, and the way it's been calculated, and any possible caveats that are related to it. And then on the far right, you can download the data, and we'll cover all of these buttons in due course. Okay, but it's good to know. Then we have our drop-down boxes, and you have lots of choices here. You have the area type, which could be CCGs, it can be local authorities at the top tier level, TTLA, as I were using that abbreviation, or district level, which is the lower tier local authority. It could be ward level for some profiles, but not for perinatal mental health. And for perinatal mental health, we have acute trust data as well. So that when you actually live in the profile, you could click on that box and see all the kinds of area types that you might want to consider looking at. Now, the data will be available at different types of geographies, and not all indicators are available at every geography depending on the source. So if we're getting data from NHS Digital, it's very often available at acute trust level and sometimes CCG level. If it's from other sources, it could well just be available at top tier local authority, and you won't see it at any other level. So depending on the area type, you will see different indicators. Okay, then further to the right, we've got areas grouped by. So this is where you can choose your NHS region, your PHE region, for as long as we may exist, or other areas, STPs and so on. So that is another drop-down box. It's relatively simple to use. And then if you've chosen NHS region, you then need to select the region you're looking at, which again, for us will be the southeast in the main. Okay. And then just below the NHS region, there's not an actual drop-down box, but there's this little blue sentence that says 10 most similar CCGs to NHS Ashford CCG. Now, it just happens to relate to the NHS Ashford CCG that's in our area box. It doesn't really matter. But what it is if you are in a region and you are utterly unique, maybe like the Isle of Wight, because it's an island, it is quite unique, or maybe, you know, Kent and Medway, or Medway in itself is quite deprived, and you think, well, I don't want to be compared to Buckinghamshire and Oxfordshire and Surrey. We're nothing like those counties or those local authorities. Then you can click on this particular line and it will select the 10 most similar CCGs to yourself. So it's based on the population statistics of your CCG and the deprivation level and a number of other factors, which I won't go into detail, but you can rely on that, and they are ranked. So the number 1 is the most similar to you and number 10 is the least similar to you. And you can do this for local authorities as well, where it might be mentioned as named as nearest neighbours. Okay, so that's another option you have, and we will be covering that in a later slide. Then we've got on the right the benchmark. So the default setting will always be England, but you do have the option to change it to your local region or your local area. So do bear that in mind, because if you're always hugely better than England, you might want to know how you compare to your actual local region, and you may find that actually you might be better than the England average but worst in your region, and so that's a useful alternative to look at, and very persuasive if you're looking for funding, by the way. Okay, now on fingertips, the huge value in this is not only this data, but it's data that's been statistically compared for you and color coded, so it makes it so easy to quickly see what you're looking for. We use in the main the traffic lighting system, so we've got green, yellow, red. Green is better, but it's statistically significantly better, so it's been statistically tested against your benchmark to say that it's statistically significantly better than your average in your benchmark. Similar is obviously statistically similar, and worse is statistically significantly worse at the 95% confidence level. Now, because we're in mental health and we don't always like to make judgments, sometimes we don't have that traffic lighting system, but we have lower and higher. So as you can see, the lovely royal blue is lower, statistically speaking. Yellow again is similar, and the paler blue is the higher. And then we can also divide data up into quintiles, which is the bar below that in the different shades of blue. High again being pale and low being a darker blue. So your data will be statistically compared, and you can just look at the colours in the main, or to give you a quick bit of information. Then when you are in your view and you've chosen an indicator for some indicators, there's a display option. So because we have even more information available to you, you can either see your indicator as a value, and when that is selected, it's greened out. Can you see that there? Display, the first box is very bright green and says values. So you'll be looking at values for the indicator, but you can click on those buttons to the right and you can look just at trends, or you can look at values and trends. So these are all loads and loads of options that you need to decide on when you're looking at this data. And finally, or almost finally, you can export it. So you can export the table as an image, and you can export the table as a CSV file. That's very straightforward. Personally, I tend to prefer taking screenshots and also using download for the data, but there is this option to export it as well. Hopefully you're all still with me. Take a deep breath, have a sip of tea, and we're going to move on. Okay, so now we're looking at the perinatal mental health profile. We've clicked on demographics. So we're in the first domain. We've set the area type to CCGs. We've chosen the overview type of visualization. We're in the NHS region and we're in the southeast. Okay, everyone's still with me. So at this geography, pardon me, at CCG level, we have 1, 2, 3, 4, 5 indicators showing, and we have this lovely RAG chart, which is showing the data in quintiles for 4 of the indicators, and it's compared statistically, excuse me, just for the general fertility rate. If you look, your indicator is on the far left. Next to that is your period, so it will tell you what the data is from. So the general fertility rate is from 2016. The women of childbearing age 15 to 44 as a percentage of the total population is from 2015. And the last one, births to mothers aged over 40 as a percentage of all live births is from 2017. And then you've got these grey buttons which help you to scroll the RAG rug. So you can make it move from low to high or high to low by using these little grey buttons in that third column there. Okay, let's move on. And I just wanted to show you, because that was a Kate slide and I don't know how she did it, but she got rid of this grey bar here. Can you see that? So below the display, in the middle of your screen, there should be a grey bar. And again, this one, it's not live, so this is a slide, but if you were to click on it and you were live, it will scroll along, because these aren't all the CCGs. We're going from, at the moment, alphabetically from Ashford to Thanet, but obviously Berkshire isn't, the West some things aren't there because they start with W. So if you were to click this particular arrow, it would scroll to the right and you'd see the ones at the far right. So when there's too many CCGs or too many districts, that's how you see the other. You can't see it all at once unless you reduce the size of your screen. Okay. So do remember there's a scroll bar there as well. Let's go with that. Okay. There we are. Now, I said there are different area types in the perinatal mental health profile. They're not in all the profiles, but they are in this one. So in this one, we have the option of looking at acute trusts. And that's what we've done. Acute trust are grouped in England. We don't have any other, oh gosh, sorry. Don't know why I did that. And we've got 3 indicators here. Can you see that? These are at acute trust level. Women aged under 20 at antenatal booking, women aged over 40 at antenatal booking, and the BAME group at antenatal booking as a percentage, because this is data collected by NHS Digital at antenatal, at the antenatal booking. So that's readily available. As you can see, it's wonderfully up to date. It's 2017 to 18. You've got the England value there, and then you've got all the trust values where data is available. Where there is a dash, the data is not available, and where there's a little star, the numbers are too small to be shared, because you'll be able to infer various things. So when you see a little star, it's usually a small data suppression going on. Okay, so that's just an example of what you could see for acute trust in demographics. We're just moving along this toolbar up here. We've looked at overview, and now we're going to look at, we're going to skip compare indicators. We're coming back to that, the map. So a quick view. I've chosen births to non-UK parents as a percentage of live births and CCGs, and I've zoomed in because there's a button there. I've zoomed in on the map. And I've looked at 2 in particular, which quite a low number, NHS Coastal West Sussex CCG. And when you click on an area in the map, it will give it you in the table with further information. So you've got NHS Coastal West Sussex CCG and NHS Brighton and Hove CCG. And this bar chart at the bottom, I'm not live, this is a screenshot, but when you're live, you can hover over the bars and see who each of these bars are. So if you did look at something where maybe you were the worst and you're in the far right and you want to contact a trust or a CCG who are doing really well on something and they're at the far left, you could find out who they are very easily by using this bar chart. Let's move on. I'm not quite sure how I'm doing for time. I think it's later than I thought. I'm just moving on now. Oh gosh, sorry, let's go back, previous. That didn't work. Previous. Yes, right. So I've looked at the map and I'm now looking at the domain of risk and related factors, but I've gone on the trend button and I just wanted to show you what that gives you. We're still in CCGs. This time I've chosen NHS North East Hampshire and Farnham because it was more interesting than some of the others. And you can see we're looking at depression, recorded prevalence aged over 18, which is a known risk factor for perinatal mental health. And the black line shows you the trend for England, and the pale blue dots with the line connecting them is the trend for the CCG. And then you've got your table with all your data in it as well, which also gives you the value as a percentage. The lower confidence interval, CI stands for confidence interval, the upper confidence interval, the England value, and then we have something called a count. Now, this is not the aristocracy. This is the people. So this is real people with heads, hands, and feet. And we give you that information because when you do actual local service planning, you don't just need to be able to compare yourself with indicators which are always percentages or rates, but you need to know how many people have had this condition or are presenting with this. So it's useful to know that in 2017-18 for North East Hampshire and Farnham, they had 20,200 people with this recorded depression aged over 18. Okay. Now, do we know what that means? The depression recorded prevalence. I don't know what that means. So you must always, oh, sorry, that was my post and my dog attacking the front door, right? You need to check the definition. So I've shown you here, you click on the definition tab and it tells you the rationale for recording this, and that is actually recorded depression. So it's not an estimate, it's recorded depression age over 18 and it's from GP records. So it depends how you feel about GP records and their recording, but that, and it gives you how it's been calculated. It's a very straightforward, unweighted percentage. Okay, very important to check that. Okay, now we're moving on. We've looked at trends, we've looked at the definition tab, moving on to compare areas. Like I said, that is a bar chart. And we've stayed with NHS North East Hampshire and Farnham for the moment, and we've stayed with depression recorded prevalence. This is the bar chart, and as you can see, North East Hampshire and Farnham are around the middle there. At 11.3, they're in the pale blue zone, but they're not at the top. And what have I done here? It's looking odd. Why haven't we got, for example, Medway or any of the Southeast CCGs here? We've got some, but not all of them. Why is that? I have clicked on the 10 most similar CCGs because I wanted to compare North East Hampshire and Farnham with their nearest neighbours. So as you can see, the rank is given there. The neighbour rank is in the column, and you've got East Surrey CCG is the most similar, and Surrey Heath is the least similar to North East Hampshire and Farnham. obviously they've got a dash and England's got a dash. To North Hampshire's quite similar, but North Hampshire's worse. So they're quite similar, they're worse. But 3, Horsham and Mid Sussex are quite similar, but they're a lot better. And the way we can tell this when you're comparing individual CCGs is you look at the confidence intervals. They're given as a little kind of hairline figure at the end of the bar chart on the right there. For those of you who are not very familiar with statistics, that's this little thing here. You can look at it visually, but I find it's better to look at these actual columns. You're given the lower confidence interval, and in this case, it's actually given you at 99.8%, not the usual 95%. So we can be very confident. It's giving the lower and the upper level of confidence. So what you need to do to compare, now bear with me, I'll just look it up because it's a bit small print. We've got North East Hampshire and Farnham. Their lower confidence interval is 11.1. Their upper is 11.5. We compare them with Trafford, no, not Trafford, Horsham and Mid Sussex. Their lower confidence interval is 9. Their upper is 9.4. So we can say because those confidence intervals do not overlap in any way whatsoever, the lower confidence interval of Horsham is nowhere near the upper confidence interval of the other one, and vice versa. You can see they don't overlap. Now, when confidence intervals don't overlap, we tend to say they are statistically significantly different. So it's worth finding out maybe why is there so much less recorded depression in Horsham and Mid Sussex versus North East Hampshire and Farnham. It could be the recording of the GPs. It could be an actual fact. It could be the green spaces in the area. It could be all sorts of factors, but isn't it interesting? And that's what this particular bar chart will tell you. Hopefully you're all still with me. I'm going to go on. So now I'm looking at the area profile, which is a very small, in this case, spine chart. I'm still in risk and related factors. I'm still in CCGs, and I've chosen NHS Medway CCG in this instance. So this is a spine chart, and we've been publishing them in Child and Maternal Health for children since 2008, I think, long time ago. They give you an indicator over here. They give you the period for the indicator. They give you then for the actual local area that you're looking at, the count, that's again, you know, the actual people, the value, that's the indicator value. Then it gives you the lowest value, the value for England, and then it gives you the worst or lowest value for England and the best highest value for England. And then it gives you these grey boxes, which you won't worry about too much, but basically the middle, the red line is the benchmark value, and then the grey boxes are divided into percentiles. And you look at the positioning of the dots and the colour of the dots. So where we've got the deep blue, we can see that Medway is significantly worse in terms of their QOF prevalence for mental health. Significantly lower, I should say, pardon me. I'm so used to traffic lighting. And the pale blue, they're significantly better for sole registered births by one parent only than compared to England. Okay, so that's kind of what you get specific. So you can get a whole list of indicators and compared to England, or if you change the benchmark, you'd be compared to the region. So that's what your area profile tab will show you. Staying with the area profile, but changing the area type to county and unitary authority, as you can see in this red circle, gives us a whole new list of indicators, because there are many more indicators available at this particular level of geography. So we now have the sole registered births again, we've got the stillbirth rate, infant mortality, and so on, and we've got a longer spine chart. Okay, but effectively it's all the same in terms of interpretation. And the other thing I should just notice is that instead of it saying 10 most similar CCGs, it will now say SIP for nearest neighbours, which is the equivalent. It's the 10 most similar local authorities. Okay. Next. Now let's change it to acute trusts. We're still on area profile, so we're still going to get a spine chart. Now we've got a spine chart for Ashford and St Peters, and you can see There are just five of those indicators available at this geography. The period, the trust for the count and the value, and then the England value, the England worst, England best, same as before. And at this point, you sort of go, oh my goodness, skin-to-skin contact after birth is really, really low for Ashford and St Peter's hospitals. And there could be all sorts of reasons for that. But isn't that interesting? Easy to see, isn't it? Very quick and easy because you've got these colours and these dots. Okay. Now, let's look at prevalence for a minute. This is a Kate King-Hicks slide. You might have seen it before. You click on the prevalence domain and you get a number of indicators. We're still at county and unitary authority. We're in the southeast region, but we're looking at it from an area profile point of view. So we're looking at Medway. Now we've got these little yellow boxes. We've got all sorts of things. We've got postpartum psychosis, estimated number of women. Chronic SMI in perinatal period, estimated number of women. These little yellow boxes mean we're not that sure about the data quality. We're talking estimates. We're not talking real numbers. These are derived numbers from research and then applying a percentage to a known population. So as the next slide will tell us, it's important to note that they are estimates. They're based on national estimates of the conditions and then applied to the local population. They do not take into account socioeconomic factors or anything else which is likely to cause local variation. Please do be aware of this. I mean, they could be of use, but just, you know, be aware. Again, click on that definition. It's so important. Moving on to the report tab. The report tab shows you the reports available for this topic area. In this case, there's just one, mental health in pregnancy and infants. It's irrelevant where you are in terms of area type or area choice or region or anything, because it just will show you what you then need to do. If you want to download this report, you have an option to have it as PDF or Word. It will populate either the PDF report or the Word document with your local data, as long as you choose in the area type whether you are a local authority or a CCG and which local authority or CCG you want the report for. So that's, if I were to click on these now and if I was live, I would get as a PDF the report at CCG level for NHS Fareham and Gosport. Okay, so that's how you select it. You see these buttons, you go, well, how do I choose who to get it for? It's up here. Okay, that's how we do reports. Okay, for this particular profile. The downloads tab gives you lots of different options. I don't know whether you'd be interested. It might be worth getting your analyst involved. Because you can get so much data, but you do get a choice these days. So you can get it by profile, all the data in the profile for CCGs, or just the CCGs for the Southeast region. You can get it just for prevalence, so just for one domain. So all the data for that domain for all CCGs in the UK, in England, or just the CCGs in the Southeast region. Or you can be even more specific and not have a massive spreadsheet. You could have an indicator spreadsheet. And we've chosen, for example, postpartum psychosis, estimated number of women. You can get the data for all CCGs in England, or you can get the data just for the CCGs in the Southeast region. Okay, these are all Excel spreadsheets. They tend to be rather massive. You can also now get really fancy, and you can get it with R, using fingertips R. You can get it with Python, API, and so forth. Don't ask me about that. I'm afraid that's getting a little too technical, but it's possible Sarah will be able to answer those questions, or we will take the questions back with us and come back to you. But that will be an analyst kind of job. Okay, data sharing. You can freely share this information, excluding the logos, free of charge in any format or medium under the terms of the Open Government Licence. But please do be aware that if you're using third-party copyright information, that you need to get permission from the copyright holders. So again, you need to check the definition to see where we've got the information from. And also, if you do use this website, could you please cite us, and the citation is in by this arrow here, and just say that you've got it from Public Health England, and that's the citation to give. Now, of course, when we change name or change organisation, who knows what that citation will be, but no doubt we will update that particular bit of information. Just quickly, because I didn't want to exclude it, there was another domain in the perinatal mental health profile, which is called identification and access. I just wanted to show you the indicators that are available, excuse me, in that tab. And they are the early antenatal booking percentage, mental health detection at antenatal booking, and so forth. And interestingly, they go into again, it's NHS digital data that's collected for the profile, and they do give you information on emotional change after birth. There's a survey score, but it's not about the actual emotional change in the woman, it's how it's been recorded. Okay, so it's a detection, it's a process indicator rather than a clinical value indicator, if that makes sense to you. That I got quite upset when I first found this out. I wanted to know if how many women said they were feeling, you know, unhappy or depressed in their prenatal or postnatal period, rather than the record that says that question's been asked. But that's what this is. That's the question that's been asked. Okay. There are other profiles with potentially useful data, and they're all accessed from the home page. The navigation and visualization is the same methodology as we've just gone through. So you've got the child and maternal health profile. Of interest, the domains that you might want to look at are early years, pregnancy, and young people. You've got the public health outcomes framework for your wider determinants. You've got local health, which may have some data of interest at ward level, although that does tend to be a little bit out of date. I'm just warning you, hasn't been updated. National General Practice Profile has got a mental health indicator section and alcohol use. Local tobacco, local alcohol profiles, and sexual and reproductive health profiles also have more indicators than are on the perinatal mental health profile per se, and may be of interest to that wider population knowledge that you may need to gather. And then you have the wider determinants profile as well. So, for example, the child and maternal health profile, just to say, on the introductory page, we've got that report as well that was on the perinatal mental health profile, mental health in pregnancy and infants. Local health profile, for example, has got deliveries to teenage mothers at district and unitary authority level. So I've gone to the local health profile. I'm in the domain of behaviour risk factors and child health. I've put my area type to district and unitary authority. I've grouped areas by region, and my region is the southeast. And I've chosen my indicator in this drop-down box, deliveries to teenage mothers, 5-year aggregate, and I'm in the compare areas visualization, which then gives me this bar chart. And there can you see deliveries to teenage mothers, 5-year aggregate. We've got information there, which might be of interest. So we've got a number of districts, Portsmouth, Southampton up to Dover, which are significantly worse than the England average. Then generally, we need to be thinking about equity and inequalities. Health inequalities are unjust differences in health and well-being between different groups of people. That can be by age, by sex, by income, by social status or class, as we used to say, a whole number, or ethnicity. There are all sorts of different ways of grouping people, okay, or even sexual persuasion. So it isn't just deprivation. And these need to be systematic and avoidable. And we have a duty to reduce those inequalities whenever and wherever we can. And that's, you know, our main aim and focus on a daily basis. And these characteristics are included, some of them are included in the Equality Act 2010. Okay, so you can read this slide. This is a Kate King-Hicks slide. You've had it before. I'm not going to go through the detail. You can read that in your own time. Let's move on, because if we look, for example, at the percentage of deliveries to mothers from Black and minority ethnic groups, I am now in the child and maternal health profile. I'm in the pregnancy and birth domain, which I've cut off, so otherwise the chart would be too difficult to read. And in this particular profile, we've got a new tab in the visualization, and this tab is called inequalities. Now, isn't that wonderful? So it gives you a quick look at inequalities. It's a shame it's not in the perinatal mental health one yet. Inequalities tend to be at a national level, so you don't need to worry too much. Those of you with eagle eyes will have spotted that the area suddenly is Derby and the region is the East Midlands. We're not interested in that in the southeast. It doesn't matter. This chart is national, so it wouldn't be any different if I had put the southeast. And just to also note, as you navigate yourself in the fingertips tool, the East Midlands wrote the tool, so they are the default regions. If you do click around and you suddenly find you're looking at the East Midlands, that is why the default button has activated itself, and you just need to make sure you go back to the southeast region or the NHS South region that you want. Okay, just to bear that in mind. So I'm looking at percentage of deliveries to BME mothers. And can you see much, much higher in the most deprived decile? This is nationally. As you can see here, the green box, England, is made dark to show you, to remind you what you're looking at. Okay, so that's of interest. Then there are two more refinements. I am kind of galloping through, I'm aware, but there are two things you might find useful in fingertips that I haven't yet covered. Okay, one of those is your own indicator list, and the other is your own area list. Now, I don't think I can cover the area list, but it is exactly the same process. And if we have time, we can cover it on the click along. The own indicator list, I'm just going to cover with you now. Okay, for this, you need to, I think it's there. We're going to be looking at that Your Data button that I mentioned at the very beginning. I hope you're all having a sip of water or tea, because we've been going quite a long time, and maybe you should stand up and wave your arms about for a minute. I can't see you. Don't know whether you can still see me, but you need to stay awake. Okay, we're almost there. We're on the home run. Okay, here we are. Stay awake. Own indicator list. So you go into the Your Data, and you will need to register. So you'll need to set a password, and you will be given access. And as you can see, I've got my own lists. Okay, so let's start a story of interest. So I'm saying I've got an interest in teenagers. I'm in Medway, and there's a relatively high level of teenage mothers and a relatively high level of sole registered births. These are risk factors or wider determinants in the perinatal mental health profile, and we will be looking at the charts in a moment. And then when I looked at these two indicators, I found there was an association between these two indicators, which doesn't mean that one causes the other, but they are related to each other in some way. And I'm thinking of creating services that reduce perinatal mental health in teenagers. What can be done? Could we prevent the births? In which case, what is the teenage conception rate? What is the teenage abortion rate? Am I allowed to mention that? I'm going to. And what is the teenage use of alcohol locally? Does alcohol influence conception? Possibly. It would have done in my day when I was a teenager, but maybe things have changed, and they have actually. Teenagers these days drink a lot less than in my day. Would it help to bring these indicators together in one profile? And the answer, of course, is yes, possibly. So mothers under 20 in the demographics tab in perinatal mental health, I'm looking at NHS Medway, I'm looking at CCGs, I'm comparing areas, and I can see that for Medway, they're not, they're relatively high. It's 138 is the count, 3.8 is the rate for this value. So there's quite a few births to mothers aged under 20. In risk and related factors, the sole registered births, the percentage registered by one parent only, is a known risk factor for perinatal mental health. So I'm looking at that again for NHS Medway in the southeast region, and I'm looking at compare areas, and there they are. The region in itself is lower than the England average, but Thanet's is quite high, and Medway is very high as well. and significantly different from the England average and the South East average. And I'm interested in both of those. So I've now gone to this tab, which we didn't look at before, which is the compare areas visualization, which is where you get a scatter plot. So you're plotting one indicator on the x-axis and one indicator on the y-axis. And then you can click this magic button over here, which adds a regression line to see if there's any kind of relationship between the two. It's not a causation. You know, we cannot say without further statistics and research that one causes the other. But when one increases, the other increases, or when one increases, the other decreases. There's a relationship. And as you can see, in this case, there is. I'm looking at all England because you need a lot of data to show a relationship. You can't do it just in the southeast most of the time. So I've got births to mothers aged under 20 on my x-axis, which is down here. And I've got my sole registered births on my y-axis. And as you can see, as we have more mothers under 20 being registered, giving birth to babies, there's an increase in the sole registered births. So that kind of also, you then have to apply logic and think, is that a logical relationship? Well, actually, yes, it is. Because if you've got a teenager mum, she may not have a steady partner, so she'll be registering the birth on her own. Yeah? Or a young mum. I mustn't say teenagers for 20s, I guess. So that's the sort of, it's logical. Sometimes you can find associations which are completely illogical or which you cannot readily explain by science or research, in which case you shouldn't, you know, take it any further. But this has some logic behind it. It makes sense. So do just bear that in mind as well. So I'm then thought I would look at the under 18 conceptions leading to abortion as a percentage. And I'm seeing if there's inequalities there. And yes, there are. The most deprived decile have a lot lower. Remember, the dark blue is lower, have a lot lower rate of abortion for their under 18 conceptions. So they're keeping hold of their babies, they're having their babies. And the least deprived decile are having the abortions. Again, logic would say that that is kind of likely, isn't it? Especially when you think that some local authorities used to give housing to teenagers who had babies, and that did influence what the behaviour of those teenagers was like, especially if they came from unhappy homes, shall we say. Okay, let's leave it there and delete it if that wasn't politically correct. Okay, I haven't said that. Then I thought I would compare the areas at the top tier local authority level in the southeast. And I'm looking at under 18 conception leading to abortion, and Medway is actually just similar to England. Can you see them? They're sort of halfway down there. Then I thought I'd look at the conception rate, and Medway, oh, look at that. They're right at the very top. They're significantly worse than the England average. So they're conceiving and then they're not aborting. And that's what's happening. That seems to be the story in Medway at the moment. And then I'm going, well, what do I do with that? How does that influence my services for mental health? Do I have the start of a story? Do I wish to reduce teenage conception rates? And how would I do that? Or if they're high and rising, would I need to provide increasing levels of support in terms of mental health services? But of course, we've seen that teenagers are having babies. They're sole registering, which is a risk factor for perinatal mental health. So they might need those mental health support services. Or do I want to reduce the teenage conception rate, which is a different public health intervention? I might be looking at emissions for alcohol and teenage conception rates, or substance use. And I've looked at these. There's no association between alcohol use and teenage conception rates when you use hospital admissions for alcohol use as the indicator in the scatter plot, because that's the best we have for alcohol. But when you look at substance use admissions and teenage conception rates, there is an association. And there it is. So I'm now in the child and maternal health profile. I'm looking at the young people domain, and I've done a scatter plot. And on my x-axis, there's the hospital admissions due to substance misuse in the age group 15 to 24, which is the age group of interest. I mean, I'd like it under, under 20, but that's not available. So this is a next best fit. And on my y-axis, there's the under 18 conception rate. And as you can see, there's an association. Just check if it's an issue for Medway. Well, no, it isn't. So then I'm looking at Medway. I'm still in young people. This time I've gone to compare areas. I'm looking at the hospital admissions due to substance misuse for the age group 15 to 24. And I can see Medway is green. In fact, it's better than the England average. So that's good news, but it was an interesting journey to have gone on. So what I'm then saying is it's useful to have a new list of indicators, and you can create your own indicator list. So when you've got your login in the your data area, you can create your own indicator lists, as you can see greened out here, or in green print, you can create your own area list, which we won't cover, but it's very, very similar. So you would click, hopefully that's going to do, no, oops. You would click on the create new indicator list. And this is what I've done. It's very, very simple. This box comes up, creating a new indicator list. It gives you a search box over here at the top left. And it asks you to name it. So indicator list name, you name it, you type that in. I've called it my perinatal mental health list. And then you can restrict the search. Well, I wouldn't restrict the search if I were you, because it's much more interesting not to. So I've left it at all profiles, and then you just click the search button. And what happens, although this is not live, is in the search results, lots of different indicators will come up that you've asked for. I've asked for conception rate. It will have conception rate in the indicator name when it searches. And then when they come up in this box over here, you just click on them and they move to the right. And these are now the indicators in your list. Can you see that? And if you have some indicators you don't like, you can clear your list. Okay. And then you can use that list and use all the tabs in the visualization just on your list of indicators. So what I've done here is this is my perinatal mental health list. This is Susan's special, as it were. And I can use all of these tabs over here, as long as the area type is the same. No, for all area types. Sorry, that's for the area list. The area type has to be the same. Pardon me there. It's getting on, isn't it? So that's where we're at. You can do all sorts of things. It's very, very useful, but it's relatively simple to do. Okay, I think we've done quite well. It's 8 minutes past 11. There are inequality slides, but I thought we'd leave fingertips there, because I've been speaking for a long time, it feels like, and you may have some questions. So shall we do questions now, and then we could have time for a click along?
Yes, hi, Susan. There aren't any questions in the chat as yet.
Okay.
So I don't know if anybody's wants to ask anything verbally.
Would you like to unmute? Have I lost you all? Have you gone to sleep?
I think Becky's got her hand up. Becky, do you want to go ahead?
Hi, yeah, thank you. That was really interesting. Thank you for that talk. Amazing amount of data on there and a lot to take in. Kind of going back almost to the beginning, you were talking, you clicked on some data about depression in adults over 18. That was done through the perinatal section. Is that for females over 18, or does that kind of, can you isolate it to women of childbearing age, so it would be older adults as well? Okay,
yes,
that's helpful.
yes. So this is where you have to look at the definition. It's the best we have, but it's not just childbearing age, and it's not just women, and you can't limit it. So this is where I'm saying you have to build up a picture using lots of different indicators where you get a bit of information, a bit of idea from each one, and start to build up, like I said, a story or an impression of how things are. But I'm afraid we don't have it but what I would suggest you do, and all of you do it that are interested, is use that feedback button and ask for it, because if we can get it from GP records, and if we were able and had the resources to filter it for women of childbearing age, which should be possible in my opinion, but I'm not an analyst, then you could have that in the future. So if we have enough requests and you say you're going to need this and it's going to be useful, then that could be something on our to-do list.
Brilliant. Thank you. That's
Okay.
really helpful. Thanks.
Any other questions? Shall we do a click along? Do you want to go and open your fingertips tool on your respective laptops or screens? And I will do the same. So I've done my usual. I've gone Google PHE fingertips because I don't know why, but I can't for the life of me remember it. And I have got it bookmarked, but I thought this was the easiest way to show it. So I've done PHE fingertips in my Google box. It's come up, and I'm going to click on mental health and dementia.
To swap the screen that you're sharing because we can still see your presentation. So if you just go to, if you unshare and then reshare and pick the right.
Yes. Thank you, Liz.
No problem.
That's me thinking it's all magic, and it's not quite, is it? Right, let's find that one. No, is that it? Can you see it now?
Yeah, that's fine, Susan.
Yep.
Yeah, that's good.
So you've got PHE fingertips in the Google search box because that's how I still do it. And then you've got it comes up. It should come up at the top because it's quite popular. And you can go to the home page over here. I'm going straight to mental health and dementia. Okay. Is everybody with me? We're going to click. Okay, click. There we are, home page for mental health, dementia, neurology. Everyone with me? I need some yeses now. You'll have to unmute.
Yeah.
Okay.
I'm with Susan.
Yeah.
Yeah. Okay. Not from Sarah or people who already know how to use the tool. I only want to hear from those of you who are new to this, please, if that's all right. So you've got your profiles by theme, and you can see the second one down is perinatal mental health. Let's click on it. Yes?
Yeah.
Yeah. Okay. So you've got your perinatal mental health homepage, and here are those lovely tools that I do recommend you look at, and I will mention at the end. The joint strategic needs assessment is wonderful. It has some very useful practical tools that you need to look at as a team, I would suggest, but we'll mention that later, and so on. There's your updates. There's your contact us for your request to have your depression recorded in GP records by childbearing women age only. And then you'd have to say what age you want. So you have to say 18 to 44 or whichever age you decide on. Okay, and whether you want it split by ethnicity, but I don't suppose GP records might have that. So that might be too much to ask, but there we are. Okay, start. Let's hit that start button. Oh, it's loading. There we are. Everyone still see that?
Yeah.
Yeah. Okay. So you've got the profile. These are your domains: demographics, risk and related, prevalence, and identification and access. Then you've got, if I go back to demographics, which I think is more interesting, and the overview, you've got your RAG chart here. Can you see I have defaulted to Derby and the Midlands? Have you all defaulted to Derby and the Midlands?
Yeah.
Yes, let's change that. So let's change it to CCGs. 2018-19 drop down menu, third one down. Yeah, click on that and then wait for it to load. And then your NHS region needs to be the southeast. That's to the right. Click on that, wait for it to load, and then you've got your CCGs. Yes. Yeah. Okay, good. So as you can see, at this level, we've only got general fertility rate, women of childbearing age 15 to 44. Let's do births to the young mothers. I'll stay with my teenagers. So under 20. So the fourth one down or second from the bottom. Click on that. And if you click on the indicator on the left, it's a quick way of going to that compare areas chart. And you've got all the CCGs in order from the highest to the lowest. If you don't like that, you click on the little value buttons and you can reverse it. Yes?
Yes.
Waiting. Okay. And you've got your count. You've got your lower confidence interval, your upper confidence interval. In this particular profile, it's 95%. So that's good enough. It's not as high as 99.8, but it's a good confidence. We can be, you know, the statistics are reliable. Okay. What shall we do next? Any question? What do you want? Where do you want to go next? What do you want to look at? Should we look at an area profile? There we are. Area profile now. I'm looking at Ashford. Who have we got here? Call out your CCG and we'll have a look.
Berkshire West.
Berkshire West. Oh, you're going to be at the bottom somewhere. No, B, on the B. B. Buckinghamshire, Brighton, no, Berkshire West, gotcha. There we are. So we're looking at the spine chart for Berkshire West. Unfortunately, there appears to be no data for general fertility or women of childbearing age 15 to 44. I do not know why, or births to non-UK parents. But we do have births to mothers aged under 20 and births to mothers aged over 40. One of which is lower than the England average and one of which is higher than the England average. Yes? And can you see, as you hover live over it, it actually tells you what everything is. It tells you the percentile, it tells you what the red line means and the value for England. Can you see? If you're hovering around, it's quite wonderfully interactive. And we can be kind of more interesting to change the benchmark to the NHS region. And it doesn't change much, actually. Berkshire West is still better, higher for the older mums like me and lower for the younger mums. Yeah?
Yeah, thank you.
Yeah, are you all happy with that? So that's kind of, you know, the quick look. Oh, we could do compare areas. Let's click on compare areas. So when you've done that, you're in a profile, you can only use the indicators that are in that profile. And it sometimes won't let you choose what to put on the Y and what to put on the X. So you might have to just live with what you've got available. And that's also a reason for doing your own indicator list. So if I wanted to compare substance use with sole registration, substance use isn't in the perinatal mental health profile. So I'd have to have my own area list and then do the association. So let's have a look. So what do we want to compare? Shall we look at births to non-UK parents on the x-axis, and then on the y-axis, adjustment disorders, distress in the perinatal period. That's an estimate. I don't like estimates myself. What shall we have? Births, sole registered births. So can you see I've got on my x-axis, which is the top toolbar there, births to non-UK parents, and on my y-axis I've got sole registered births. I've got a scatter plot for all of England, and I'm going to add a regression line, and there's no association. Okay, so there's no relationship between the two. I didn't think there would be, but I thought there could be. Who knows? If they don't speak English, maybe only one parent would go to register the birth. Who knows? Maybe that, you know, one of the two doesn't speak English, one does, and they've gone to register the birth as a sole person. Then again, or they might not. Yeah, they won't be in a couple. I'm talking nonsense. Pardon me. It's getting late. Yeah, so no association there. Anything else people particularly? Oh, let's have a look at the map. So click on the map now. Look at births to non-UK parents. So and we're still looking, just because we've put the benchmark as the NHS region. We're just looking at our NHS region, which is still, and some of it's grayed out where we don't have data. You can zoom in on it a bit, and we can look at where the registered are high. So, oops. I'm on Dartford, Gravesham and Swanley CCG have quite a high level, and they've now come up in my table. So they've got 1,003 people births to non-UK parents as a percentage of live births. It gives you the confidence intervals, and they're over here. Can you see the grey bar that's appeared in the bar chart? Everyone still with me?
Yeah.
Yeah. So you can hover over this bar chart. Can you see how it changes? It can tell you that the highest in the region is Crawley and the lowest in the region is the Isle of Wight. And it's not very interesting for the births to non-UK parents, but if you say we're looking at something like asthma admissions, for example, just to take a completely different clinical example, so excuse me for that, but that it's very interesting to see hospital admissions for young children and for asthma, you know, who's very low and who's very high, and then you could find out why that is. You know, it takes you on a journey of discovery, and I find this bar chart very useful for that. Okay, so that's kind of a quick and dirty. Shall we go back to the slides? Is everyone happy? You've had a bit of a click?
Yes, thank you.
Yeah. Do you want me to show you how to do the data? Because I'm logged in. In my indicator list. Wait for it to load. I've clicked. You won't be able to do it until you're registered. So here I am. I've logged in. So what you do is you create your new indicator list. I'll give it a name. I'll call it Mental Health Test 2. So yes, okay, maybe I'll put breastfeeding and I'll search the profiles for breastfeeding. Search. And look, it's given me a number of breastfeeding indicators. Yes. All I'll do is I say, oh, I like the one, oh, first feed is interesting. That might be skin to skin. First feed, initiation, I'm interested in, and I'm interested in prevalence, and I want the current method, not the previous method. And see, I just clicked on them and they move to the right onto my list. And then I can go back to my search box and say, now I want to know sole registered. Sole registered. Let's see if that's enough to search on depression. Oh yeah, sole registered births comes up. Can you see that? And I can click on that and it adds to my list. And now I have a list that's about breastfeeding and sole registration of births. Yes?
Thank you.
Yeah, everyone happy with that? And the area list exactly the same. The only thing you have to remember is when you then look at your area list, it won't come up in your box. It's an option when you're on a profile. So let me just go back to the profiles, and you do that by going home. And I will look at the child and mental health profile for a sec and go to start. Let it load. Then when I'm in my region box, oh no, it should be areas. Oh, areas grouped by box. So in the areas grouped by box, when I've got my own area list, can you see I've got one there? I can go to my own area list in the drop down box because I've created one. But I haven't created one at this level. So I'll cancel that. I have created one at CCG level, I think. With me. Area list. Oh, I haven't done one at CCG level either. Sorry. I've done one at acute trust level. If I just go back home and I'll go to the perinatal mental health profile, mental health and neurology, perinatal mental health, start. And then I'll set it to acute trusts. Wait for it to load. Sorry about this. Okay, and then I'm going to go areas grouped by my area list. And I have one, and my area list is PMH 2 acute trusts. My area list, I chose random trusts actually. I chose Ashford, Buckinghamshire, Brighton and Hove, East Sussex and Frimley. Can you see how that's kind of unique? Hello?
Yeah.
Yeah? You can't do it because you won't have been registered yet, but I'm just showing you, if you look at my screen, you'll see that I've just got those 5 trusts and the data that's relevant for those, available for those acute trusts. So you do, when you do your own area list, you must think about the indicators you want to look at. What geography they're available at, and then choose that geography as your area list. So don't, you know, if I chose top tier local authority, but I wanted to look at an indicator that's only available at acute trust level, it wouldn't work. Is that clear to everyone? Yeah? Okay, let's go back to the slides. I will stop sharing. I'll go down here. Oops. I'll stop sharing and share again and go to the slides, and we'll finish. Right, okay, one current slide. There we are. Okay, we've done a click along, if that's all right. We've not got very long now. We've got the questions, we've done the click along. So you've got a slide you can read for yourself in terms, and you've got a link there. I just wanted to say this is a very useful slide to just look at. It gives you all these tools, A, B, C, D, E, F, G, and all the tools do something different. It's on this slide. It's easy to look at for yourselves. For example, for tool A, I'll give you the link there. And it gives you 10 questions. So you need to be sitting in a group of people who are going to be collaborating. And it asks you questions about scope, planning, delivery, and evaluation. And you need to sit there and go, have we got leadership in place? Are we fully committed to these health inequality goals? Have we got a GSNA, which is both bottom up and top down? So have we worked with people, you know, at the coalface and the actual stakeholders, as well as the people of senior leadership, and so on. It's quite, you know, self-explanatory, really. But like I said, you can't do it on your own. You need to do it as a partnership with your other partners and with your team. You then have a screening tool in tool A, and it gives you worked examples, and it's basically categorizes where you're at on your journey. So you can be emerging, which is you're just starting your journey. You're developing, you've made some headway. Maturing, you're quite a bit way along. And when you're thriving, you've got it. You know, you're there. Your health inequalities are amazing, and your services are totally geared up to it. And the examples that are in the tool for each of those 10 questions are quite detailed. So you can see, is our organization like this one, or is it like that one? And you can pick where you are and see, therefore, maybe then with some common sense, you can decide what is it you need to do to move from one to the other. And they're all like that. So there's tools B to G and so on. This is a Kate slide, and you can contact Health Equity at PHE for further support. Then there's some more just background information, just to emphasize this again, because we would need to emphasize inequalities. This is a Kate slide. I'm going to whiz through these. You've got the acts to look at. You've got health equity assessment tools to think about. You've got this to think about. I'm not going to read it out because you can do that by yourself, but I do want to get to the slide which says, speak to your local public health team. That's very, very important. They're super friendly. We talk to them once a week, the analysts, that is, and they're just a super, super team all across the Southeast. You'll find them very helpful indeed, because they work with this data all the time. What I did want to mention is a different tool. So this is your next webinar, possibly. We can do a webinar for the SHAPE tool for mapped local data, and the link is given there. You need to register to gain access, and it shows you all sorts of wider determinants and data on a map. Okay, and we are running one in October. This is where Sarah Priest will give you the time and the date.
Hi, yes, 1st of October. 3 to 4 p.m. We're doing a webinar on SHAPE tool, excuse me, and also the segment tool, which you can use to look at health inequalities. Sorry, yeah. We can send you a link after. Yes. I'm sure you'll.
And you'll say, I think those links have already gone out. They went out as Kate gave us the information, so we sent them out a couple of weeks ago. So people should have them, but let us know if not.
Yeah. So here's the taster on your screen now. This is what SHAPE can do. So I'm looking at Medway. I've loaded a layer of deprivation, which is at MSOA level. So and the very dark purple is the most deprived areas. And I've mapped the NHS services in the little red dots onto it. So you can kind of see that the services are not necessarily where the deprived areas are. Some are and some aren't. And then you can do all sorts of more things. This is just a quick taster. It also now has COVID related data, which is mapped on there for you, and you can segment the population. So I just wanted to show you that, so you have seen SHAPE in action, as it were, because until you register, you can't play with it. You do need to register for this tool. So these are the other sources of data that Kate King-Hicks has already given you. And there's an inequalities tool in the fingertips page, which personally I have looked at, and I wouldn't say this is your first port of call, because it's not that easy to relate it to perinatal mental health. That was the click along the questions, and we're all done, and I'm there. Thank you very much for listening and participating.
Thank you so much, Susan. That was really informative. I've certainly learned some things this morning. And I think, as Susan said, if there are questions, which I'm sure there will be once people start playing with the tool, then please do get in touch with the team. You will have the slides sent out to you. We'll also send out the link of the recording, so that for those that had to leave early, they can watch the rest of it, or you can go back and review the information that's been given. But thank you, Susan. That was really informative.
Yay!
Lovely.
And thank you for participating. Thank you. It's been brilliant. Lovely. Thank you. Oh, and any feedback is appreciated. Yes, we need it for my whatever, appraisal. That is if I have a job in the long term. Who knows? Okay, bye then. So is that it? Yes.
Thank you, everybody. Our next main webinar is on September the 30th. So we will look forward to seeing everybody then, and obviously information from today will be sent out in the meantime. All right then, thank you.
Lovely. Thank you. Bye.
Thank you.
Bye.
Thanks everyone. Bye.
And just a quick reminder from me that we've asked for examples for the next webinar of how services are working collaboratively with IAPT services. So we've had a couple come in, but any more would be really good for that webinar. Thank you.
Lovely. Thank you, everybody. Good luck with your bids.
Yes, good luck. Absolutely. For me too.
Do get in touch if you need any additional support.